Thanks for joining. We're going to go ahead and jump in. I don't know when the online part will start, but hopefully they'll be able to join us as well. We really appreciate you coming to and coming to the session, and it'll be really nuts and bolts stuff about peer review and the editorial process, and really about peer review research in the climate and health space. But I just want to introduce myself and then quickly share a few thoughts, and then we'll turn to our panelists, who are our experts today. So I'm an emergency physician. I do consider myself a climate advocate, and some of my thoughts will play into what that means as a member of a journal. So I'm the managing editor of the Journal of Climate Change and Health, and was part of the founding team, and it's been really a great adventure for us, and the purpose is to bolster the evidence base for the changes that I personally believe were already needed. And so that brings into my question. So our panel of experts will share their advice on a lot of aspects of publishing high quality research in the climate and health space. And they'll get into the nuts and bolts, as I said, but I want to kick it off by briefly exploring some of the connections between peer-reviewed research and advocating for change based on that information. So what is the ultimate purpose of research? And so I went online, looked at some definitions, and again, lots of different definitions, but research can be defined as the systemic investigation and study of evidence in order to establish fact and gain new insights or understanding. Well, what's the goal? Is the goal to lead to change, to new approaches to problems? And if so, is research itself a form of advocacy? What's the definition of advocacy? Advocacy can be defined as activity that influences decisions and encourages change. But how do we advocate without jeopardizing the validity and unbiased purity of our research? How can we avoid bias when studying climate change and its impact on health, when our drive to research in this space in the first place stems from our concern for the environment and for the health of our community? So there's a spectrum from disinterested fact gathering to studies that are really designed to demonstrate the superiority or the impact of a specific approach to a problem. And some may believe that the purity of the former is the ideal, but others would argue that we should not shirk our role as engaged and knowledgeable experts, but rather engaging in this way serves the ultimate purpose of doing the research in the first place. Does the time pressure of climate change impact the proper position on this spectrum? Does it hamper rather than damage our credibility when we fail to advocate for the position made clear by our research? If the results are so important and powerful, how can we, as caring human beings, not pursue the better path that our research makes clear? Finally, can our research be considered successful and valuable if it demonstrates that certain actions are beneficial, but they are not then implemented, especially when the stakes are so high? How is this balance influenced by also being a physician or a healthcare professional whose mission is to serve people and improve health outcomes? So again, we're going to get more into the nuts and bolts, but I thought thinking about some of these things might be valuable as we talk about it. I want to just quickly introduce our three panelists, and that we won't do intros in between. They'll each talk for 5 to 7 minutes or so, and then we've got questions, and we'd love to take your questions as well. So we've got Dr. Alexander here, who I work closely with. She is a physical medicine and rehab physician, and she is the founding editor-in-chief of the Journal of Climate Change and Health, and she'll be talking about preparing your submission and selecting the right journal for submission. We have Dr. Caren Solomon, who's an associate professor of medicine at Harvard and a deputy editor at the esteemed New England Journal of Medicine, where she edits their fabulous series on climate change, particular focus on fossil fuels and pollution. And she's going to talk to us about the editor's process to evaluate patients and features that are important to editors. And Dr. Mary McDermott is here, professor of medicine at Northwestern, deputy editor at Journal of the AMA. And she's going to talk in detail about the peer review process, its importance, and some tips for reviewing papers. So I will turn it over to Marc.
Hi, everybody. I'm Marc. Is there somebody, or can I have a clicker to advance the slides?
I'm going to have to do it for you.
Okay, so you're going to have to advance them a lot.
Yep.
So I'm odd here. I'm with the New England Journal and JAMA, and I'm just the Journal of Climate Change and Health guy. So thanks for all being here, and we really appreciate it. And one thing I really want to say about climate change and health is we are a field that's in our infancy. We are not even adolescents yet. So as I think about this society, well, this initiative we're in here and the journal, we are just starting out. We don't know the problems yet. We don't know who's impacted by everything. Not even everybody believes we're a problem or our issues are problems. So that's where I come at this. Okay? And one thing I'd also say is I am now on a society you'll hear about in the future, the executive team of the Climate and Health Society. Because we have a journal, we need a society that goes with the journal. So we did things a little backwards, but we're working. This is the Journal of Climate Change and Health. How many of you get it? Okay, you should all have your hands raised. It's free. It is an open access gold journal, and we have gotten 66 papers submitted so far this year. So if you want to learn about climate and health, please sign up for our alerts. Once you get the alerts, then you can have the articles for free. So it's a free climate and health education. We are, and that was 60 when I made this slide a couple of days ago. It's 66 now, not even a week later. But what we do is we publish original research, review articles. In fact, we have a review series that goes through many, many different medical specialties. So if you haven't looked in your medical specialty, it's a good thing to do it. Short communications about emerging issues, and then short communications research. And then we even have creative correspondence, and we've published a couple of books. And beautiful cover there. We have different covers every month. And you can reach out to Amelia Cousins, who's in England and works on our art and our covers. So this is a journal that is run on love. Next slide. And I am really good at getting people to do work for free. This is our editorial board. Somehow I pitched this journal to Elsevier back in 2020, and this was the fastest journal that Elsevier ever got in line. We had our first issue, which actually Ed and team of people from around the world published something in one of the very first couple of papers. So you can see we have a very diverse editorial board. We've got people from every continent. We've got a lot of US-based people, but we are an editorial board that will rotate. It's not going to be a permanent editorial board like some journals that if you get on an editorial board, you're going to be there forever. But this is an editorial board that works. They work closely with me. Marc has put in a lot of time and effort into this. Tina Duhame on the left is a neurosurgeon from Harvard. Alyssa Gordon is a pathologist from Cleveland Clinic. Andrew Olungenju is a psychiatrist at McGill. Yeah, McGill. And Eva Parker is a dermatologist from Vanderbilt. And you'll see Barb Ernie's here. Many of you know her. And you can also see Bruce Becker somewhere is on that screen. And he's part of our editorial board. Am I missing anybody that's here? Bruce is in the room.
I love that Alyssa has the microscope in her picture.
And this was a really hard slide to make. I want you to know. I did this all by myself. So, you know, you can see I'm kind of the more laid back journal, aside from these very bright, erudite journals. But next one. So what does our journal publish? And why do I think it's so important that you read it and get involved? Well, it comes from a vision. And my vision is that every doctor in every exam room is thinking about this as an issue and incorporates it into their care of their patient, similar to smoking. Now, of course, everybody doesn't do smoking, but this is our vision. We've got to have a vision. And so my frustration was when I would read like the Lancet Countdown papers, and still when I read them, they're so up here and so public health focused that I'm learning all this big picture stuff and I can talk about it, but what do I do about it, right? this is the go, just do it journal. This is where we need those papers. So we started out with having special focuses in the areas that we thought were the most important. And we've been fortunate, as a new journal, there's like a ramp up process and you can kind of, all these papers are open access. So the way open access models work is you pay to publish your paper and then everybody can read it. But in the beginning, we were able to do, like the first year, we were able to do free papers, and they raise it up a little bit. And we're still in the point where we're in the final session of our special issues being free publication. But the first and historical special focuses we've had, and these are all available. If you go online, you can just download this whole special focus. One's on communication. So we've got a broad base of articles on that. The one underneath is getting to a greener, healthier world by 2030. And this is one of the first ones we did. And we were able to get some really just good short clinical communications. Like, you know, this is what we did at Harvard in internal medicine about ordering less lab studies and then getting more into the carbon footprint of lab studies. Or this is what we did about food. Now, this is how we did our waste audit here in the ER. We did a waste audit in rehab. Different actions we can all take. So these are some of the background ones that we've done. Then, on top there, we have one on transdisciplinary collaborations. Nicole Redvers is actually a Indigenous scholar. He's one of our journal editorial board members. And Arthur Wins is a big climate health policy guy internationally, who was kind of in charge of the COP climate health stuff. He did a lot of that. So we've got some nice international collaborations to talk about. When I say international, I mean things like, you know, maybe Fiji or Bangladesh, or, you know, we're not all US focused. So I think it's really important to get insights into other countries and what people are doing, and especially our colleagues up north. In that country, you know, we should all join them instead of they join us. You know, all their deans approved having planetary health in the medical school curriculum. Okay. Well, that's not going to happen here, obviously, because that would be even worse of a word than climate and health. But they're able to do some good things. And if you go and you look at some of their papers, they're wonderful. And there's a lot to learn and a lot to emulate and put into your clinical practice. Next. So these are some of our other topics. A health specialty focus lens. This is the one where we have different specialties and scoping reviews in many specialties. And I'll give you, for instance, like we did one on anesthesia. And we know in anesthesia, there's, you know, the issue of nitrous oxide and desflurane. So they did the scoping review. It wasn't on sustainability, though. It was on the issue of anesthesia and the negative impact of anesthesia related to climate change. So it's got a little bit of this. And instead of finding 100 papers, I found one. So you might do a scoping review and only find a couple papers, but then it's telling you what you need to do in that field. And it's telling you, you know, where the knowledge gaps are. That's part of what we're finding is where the knowledge gaps are, so we can get each healthcare field moving forward. So we did something on health inequity, which we'll talk about social determinants of health. There's a nice paper in there by Kyle Hill, who's in the next room. He's an Indigenous scholar. He's in Minnesota now, a psychologist. So we're trying to get at some of these areas that there are not big papers that you can submit to the New England Journal or to JAMA on. We're like the little journal that's going to grow. And in that sense, we've also done something on ethics. And thinking about ethics, you made a comment about, I forget what it was you made the comment about, but it reminded me of a good article. Oh, it's like, are you a researcher or are you an advocate? There's a great paper on that. So some thought-provoking topics. I learned about ecofeminism, reading one of those. Does everybody know what ecofeminism is? No, I'm just dumb then. All right, well, I learned about it by reading this article and learning more and that sort of thing. So a lot of good information. And we're doing right now, go back, Africa, Asia, SIDS, and Central and South America. So I want to say about this to all of you, more than anything, I need your help. I need your help, not just as authors, but as reviewers. And I'm going to make the case that you get a lot out of reviewing because number one, you learn. You learn what's good to do. You learn what's bad to do, but you get ideas. You get ideas for what you can do and how you can add to the research in this field and also the clinical care. And a lot of times I hear from people that nobody wants to do reviews because you don't get paid, but you've got to realize it's a give and take. And so the journal runs on love pretty much. And love is what's going to solve our problems. All right. So the right journal, I sort of talked about it. The question is, what are you going to share? What are the implications of the information you're sharing? If it's really basic in our growing nascent field, then you probably want to be talking to the people in this room. You're probably not going to get on 60 Minutes with a paper that you put in our journal. Who is your target audience? Is it students? Is it people in your specialty? And how unique is your information? I try to make sure that the information in our journal is something new to the climate and health field. For instance, if the radiologist had published on something, but climate and health hasn't, we'll consider something like that. So it's a balance. But the other important issue is, do you want your information out there for everybody to see? And what I would say is, this is a tool we can all use. If you sign up for the alerts, you can always get the information out there. You can hear about what the medical students are doing. The Medical Students for a Sustainable Future just had a letter to the editor accepted. Again, there's a great paper. It's a great paper on planetary health rounds from a guy named Tajik Farrar in Canada. So this is the question is, who do you want to see your info? Next. How do you prepare your patient paper for publication? Go to the information authors. Pretty easy. Read it. Make sure your paper is relevant to the journal. You don't want to waste your time getting it sent back. I get papers that aren't relevant. I just have to send them back. Follow the information. When they say put your references in brackets and number the sections of your paper, do it. That's all it is. It's simple. Don't rush. Pay attention to detail and realize you're going to get frustrated. I mean, you might, it's a pain. Who in here has ever published a paper? All right. Was anybody not frustrated? Right? And who's not frustrated when it takes a long time to get your paper reviewed? Anybody? So that's why we need reviewers. So that's what I have to say, and I'll turn it over to my colleagues.
Beautiful. All right. Thank you. So in advance, it is a pleasure to be here. Next slide. So anyway, can we just advance them?
Sure, it's just about you.
Yeah, which is a little right, but you get beautiful. Yeah. Okay, so what I want to do is step back, kind of take a long view of, how do editors look at your papers? I think it often seems like a big black box. You mail in a paper, you get back good news or bad news. And kind of what happened. So I'm using the New England Journal as an example, but I can tell you that this general process is pretty similar across all the high impact journals and actually all the journals. Yeah, okay, we just sort of have more at the JAMA and the New England Journal. We have more people doing it, but same concept. Okay, so for us, first thing, manuscript comes in and somebody checks to see if it's a trial, because if it's a trial, we need to make sure it's registered and somebody's actually sitting there and making sure that things concord with what's in the paper in that regard. Presuming it is okay, the editor-in-chief is taking a very quick look. And the question is really just, is this in the huge ballpark of what we might publish? If it's a case report or a case series of something that's been well described or a detailed economic analysis, it's just not going to be right for us. And then it goes right out without seeing other editors. but the vast majority of manuscripts are getting assigned on our standard track if something isn't being expedited. And if you guys have questions about expedited review, I'm happy to go into that. But it goes first to an associate editor, and our associate editors, we have 8 of them that work with us. They're specialty experts that are 20% time individuals. They read it. Again, it's, they're reading it fairly carefully, but it's like, can I imagine this might be published? If the answer is yes, it goes out for review. If the answer is, I don't think so, good news for everybody, there's sort of a second chance because it is actually also looked at by a deputy editor, of which I am one, and we can save something and send it out. And at least a couple of people have read something carefully if you get something back and it has not been reviewed. Peer review, Mary is going to talk about in detail, but I want to just make a couple of comments about peer review. One is that, peer reviewers can be tough, editors can be tough, so thick skin is always good. But more importantly, just remembering that at the end of the day, editors, not peer reviewers, are making the decisions. So peer reviewer input is critically important. But sometimes when you send it, and you get back really nice comments, and yet the paper has not been accepted, humongous frustration. And I want to say that generally what that represents is that editors in a discussion in the room had concerns that were not reflected in the reviewer comments, or particularly in journals, they can take a small fraction of what they receive. It's a priority decision, and the paper is really good, and it's going to be published somewhere really good, and it just isn't necessarily in that first journal. And I only put this out to show that a lot of journals, a lot of papers that we do not take actually have really good reviewer grades. They're good papers. Okay, so peer reviews are in, and we meet, and again, a sort of distinction between the high impact general medical journals and the specialty journals is kind of how many people might be in the room talking about a particular paper and for how long and how often. So we meet a lot, and we talk at great length about papers. Okay, so if something sort of gets through a discussion like that and it's looking reasonably promising, it goes to a staff reviewer for a detailed statistical review. And I'm not going to get into the reasons that issues come up, but they're generally fixable. If we've gone far enough to think we might publish it, usually the staff reviewer comments are going to be addressable. Occasionally not. Okay, so I want to move along to, for a high impact general medical journal, I don't want to speak for Mary, but you can correct me later if you want. But for us, what we're looking for is, number one, your studies addressing, I'm talking here about original research. Okay, so your studies assessing an important question. And by that, I mean that it's going to affect practice in some way. It's a new treatment, a new intervention that maybe is going to be useful for people. Maybe there's great data on it. Maybe it's more preliminary, but really novel way to treat a disease, or is going to teach us something about the biology of disease. I know you all know that it's supposed to add to appreciably to what it's out there. So people talk about being first, last, or best. Okay, I want to make clear that although our journals publish lots of randomized trials, you do not have to do a randomized trial to get your paper published in a high impact journal. And I really like this little BMJ thing about parachutes. So we don't have randomized trials that tell us that parachutes are useful, but they are. So there are going to be lots of areas that are not going to be feasibly studied in an RCT, and you certainly see those published in journals. Whatever your design is, you really need to have sound methodology, and editors and the statistical editor are going to be really combing over that. And I'm not going to read through all these. And again, if you guys have specific questions, I'd be happy to. Just going to point to the one on the bottom, which is pretty important, which is that if you're doing, a trial, you're trying to answer a question, you just got to make sure that it is big enough that a negative finding is an informative negative finding. And I kind of put an exaggerated version of that up there, but one reason that papers often cannot make it for us is that, the authors study some intervention and they find, no significant difference between groups. But when you calculate a relative risk or an absolute risk difference with a confidence interval around it, the results are compatible with like lots of benefit or harm, and you kind of just can't make any conclusions. So just be thinking about that in your design phase. This seems like a no-brainer, but I will still say it. It's important that your conclusions follow from your data. So sometimes people get super excited, they kind of spin off. They may focus on a subgroup and kind of go off on that. So you really just want to kind of stick to what your primary plan was and build your conclusion around that. Of course, your research has to be ethical, and I'm not going to get into that in detail. I want to talk about representativeness for a sec, just to say that we rarely reject a paper because it is not, including a sort of fully representative sample, but we are acutely aware of it. It comes up at every editorial meeting. Somebody's studying asthma and there are no Black patients in the study. Okay, so obviously thinking about that in design, as you guys know, the NIH used to want you to think about that in design. Now they want you to ignore that in design, but ideally, you're going to have a representative sample, and we actually have people put in their supplementary appendix. What are the characteristics of individuals who have this medical condition, and then how did that jive with who you studied, and acknowledges a limitation if there are difficulties in that regard. When papers are not accepted, 3 major reasons: quality of the study, novelty, great study, but just did not extend enough from what was already out there. And then the last one is that it's considered better for a specialty journal. And I will say that can be gray, but we kind of talk about it a lot. You want to edit really carefully. You can always remove words, I want to assure you. I'm going to take the last few seconds. I try not to go too long, and just say a little bit about what we're publishing, just to give you an idea. So I only put up sort of a few examples of what we published on climate and health in the last couple of years. And there are so many more that I could have put on here and should have put on here, but just to show you that it's a mixture of original research, lots of review articles. We've had opinion pieces, so perspectives and sounding boards. And then we've had cases as well in our clinical problem solving or interactive medical cases where patients have developed, infections and such that are clearly climate related. And then just put up a link to our climate page if you guys want to, look for any specific items. So just to kind of wrap this up, I want to say that this is clearly becoming a difficult time, or a more difficult time, to get funding to do this kind of work. At the same time, as we all know, it is critically important, increasingly important. And I want to emphasize that we and other journals are very, very interested in seeing this work. We're really committed to publishing this. So I hope we'll see it. And I want to say that if you do have, Marc already alluded to this, if you have a study and you're kind of wondering if maybe it's right for the journal, you can always send me an email. We also have a little spot on our website where you send in an inquiry as to whether something is right, and just ask. We can never sort of promise that it's going to come in, but if it's, if it's good, but it's really small or really, kind of a more niche topic, we might say, don't waste your time here, but then on the other hand, if you send it in, it's getting a really careful look. So thank you, and I'm going to pass it to Caren.
So I'm going to speak today on behalf of JAMA. My name is McDermott. I'm a deputy editor at JAMA. I'm also a physician scientist at Northwestern. I spend about 20% of my time at JAMA, so I'm both an author and an editor. Let me first begin by talking a little bit about JAMA. JAMA is now more than 150 years old. It is one of the leading medical science journals, and JAMA has a so-called JAMA network. There are a total of 13 journals including JAMA, ranging from JAMA Network Open, which is our open access journal, and then you can see a variety of subspecialty journals as well. The way it can work is if you submit your work to JAMA, it's helpful if you select one of our subspecialty journals. Maybe it's related to cardiology or public health. If JAMA decides not to publish it, then we can send it along, sometimes with reviews, to one of the other journals, and you don't have to submit again. We receive a lot of manuscripts. JAMA receives over 10,000 a year. 75% are rejected without peer review. 25% undergo peer review, and I'm going to be talking a little bit more about peer review today. All right, let me talk a little bit about peer review at JAMA. We typically send out manuscripts to 3 peer reviewers. If it is original science, typically that will be 2 content reviewers and 1 statistician. We have a database of peer reviewers, and we actually, after a peer review is completed, we rank the quality of that review. So when I'm selecting peer reviewers in a particular area, I'm usually looking for people with fast turnaround times, typically less than 14 days, who've received a very good or excellent on their rating. As Caren told us, the editor is doing a lot of decision-making about the quality of the work, about whether it's new, but we really need peer reviewers to help us with some of that. Is it high quality and is it novel? So when I send something for peer review, I'm looking for an expert in the area to tell me more about, is the work valid? And were the methods appropriate? Are the findings new? And are the data important? And some of that an editor can judge, but for example, thinking about osteoarthritis, for example, sometimes there's a certain outcome that has significant limitations, which since I'm not in rheumatology, I may not know about. Or there's other work that's been published on this topic that I'm not aware of because I'm not entrenched in osteoarthritis. And we really rely on peer reviewers to tell us about that other work. Are the data really new? And are they important in the field? In addition, a peer review is providing feedback for the editor from an authority who is unbiased. So we ask and trust our peer reviewers to let us know about conflicts of interest that they may recuse themselves from reviewing for. And again, the content experts are going to know about the literature already in the field. They're going to know about, are the inclusion criteria important, or if you know, sometimes maybe the inclusion criteria make one less certain about whether the patients in an OA osteoarthritis trial actually had osteoarthritis. That's the type that a peer reviewer, specialty expert, can tell us about. So it really helps us to ensure the validity and the accuracy of data. We're looking for timely peer reviews. If you know you can't review within 14 days, then it's best to let us know that, or you could ask for additional time, but we're really trying to speed our review process. We want a fair and neutral evaluation. So if it's your top competitor in the field that you're asked to review a paper for, we would ask you to either be sure that you're providing a fair review or perhaps recuse yourself from that evaluation. We want our reviewers to be thoughtful, we want them to be thorough, and we want them to be accurate. So really taking the time to go through every single aspect, read the whole paper, look at the supplement, look at the method, the clinical trial. Yes, look at the protocol, look at the clinical trial registration to make sure it's like another check. Is the trial following the original? So again, using your specialty hat if you're asked to peer review, looking for major limitations that in your field you're going to know about. Are important references cited? How does this work fit within the context of what we know already or what we need to know about a topic? And then again, you know, I'm interested in knowing, you know, do you think the conclusion is appropriate? And editors absolutely think about that, but I think it's really helpful for you to comment on it. And I would say that not every journal is as good as evaluating the conclusion, but I'm surprised how often I see not at major journals, but at some journals of a cross-sectional study using causal language to talk about something that really is just an association with probable confounding. When you provide your comments, there's no right way to do it. You might want to do major comments and then minor comments, but I do think it's really helpful to be organized, whether that's by presenting your comments in the order of the paper or doing a major comments, minor comments section. I think it's important to be positive. Maybe you thought it was a really bad study, but hopefully you can find some positive things to say about it, maybe the topic. Using civil and constructive language, even if you're sort of feeling strongly that it's not well done or it left out your work or something like that. And then I just wanted to say a word about revisions. When revised manuscripts come back and you're asked to re-review it, make sure that you read the whole response letter. And I know that's a lot of work. It's common for us to get, you know, 25 or 30 page single space revised letters back, but please read it all. And I'm also surprised how often the the authors might say, yes, we did this, and then you look in the manuscript and actually it wasn't done. So it's really important to double check and make sure that they actually done what they did. And when you're an author, you know, instead of just saying, we did this, done, that's not very helpful to a reviewer or an editor. So saying, here's what we did exactly, here's where you can find it in the line. That just makes the review so much more helpful to the peer reviewers and the editor. My last slides, JAMA launched a climate change insight series a little more than a year ago. These are, many of them are invited manuscripts, but we also welcome uninvited manuscripts. They're short, 1,200 words or 1,000 words with a table or a figure. And the series is intended to be about climate change and human health. So we're interested in climate change topics with relevance to human health. And here's one of the insights that we published about thunderstorm asthma and climate change, which talked about this phenomenon of thunderstorm asthma and some episodes in Australia where after a particularly windy thunderstorm, thousands of people suddenly went to the emergency department with bronchospasm, and talks about the phenomenon and how one might mitigate it. So we do welcome your submissions on climate change, and I put my email address here. If you do have any questions about submissions you'd like to send, I'd be happy to respond. Thank you so much.
Thank you all so much. Let me just say, if you're not reading these studies, these articles, you are really missing out. The New England Journal of Medicine Climate Change series is excellent, but also the insights, and of course every article in the climate change and health. So I have a few questions that I've prepared already, but I certainly don't want to sort of give them priority over questions that you may have. So maybe we'll just start right with the crowd.
I have a question as a reviewer. I feel like I'm an expert in my field, but I'm not the best statistician. So when I'm commenting, I'm always a little worried that maybe the statistics need to be addressed and maybe they don't have a statistician also peer reviewing. And so I, make sure I have like a very comprehensive response in terms of my comments, but how do I make the editor make sure that there's a statistician to also look at that?
I mean, if you say it in your comments, we're going to do it. We don't automatically do it for every paper.
Like, am I just, I don't know. I feel conflicted about it.
Well, I think the people that are the editors have some degree of statistical knowledge too. So if there is any request or any concern, we'll make it happen. And that's just, that's not uncommon that people write that. It's pretty common. People write that.
And I was going to say, any of the sort of high up, the journal, we automatically statistically review things, but I think when, for sort of smaller subspecialty journals, just align. But I think the issue, as you said, is that you're not being asked to comment statistically, but I think it's nice to say you're not able to.
Okay, yeah.
I just want to add that it's pretty common for peer reviewers to say that and not the major journals, so I wouldn't feel bad at all. And if there's something in particular about the methods that you think a statistical reviewer should comment on, I think it's helpful for the editor to know that you've put up.
I do say it, but then I always feel badly about it. So I just
Typically, there's sort of comments that the authors will read, and then there's comments that'll go just to the editor, and that's where you can say, like, don't feel really comfortable opining on that part, but the rest. But like, this is one aspect that I'm not expert at, just so you know. I think you're just giving information to the editor.
I see a lot of like climate and sustainability kind of work in healthcare analogous to where we were in antibiotic stewardship in like 2005, 6, before we started having, we were in our infancy. We started with like surveys about attitudes about, antibiotic use. It seemed really not very high level, and then it just kind of really has progressed. And I wonder about right now for the next 4 years, we're going to have to decarbonize healthcare because that's probably the only major thing we could do. Can you imagine every hospital not having desflurane, decreasing single-use plastics in healthcare? And I really think a lot about the UK Center for Sustainable Healthcare, where they do quality improvement projects and they give you social, environmental, financial benefits of their projects. And I feel like there's no home for that work. I mean, people are doing that work, but then you want them to get academic credit so they can get promoted. And I feel like if we had a home for that kind of a framework, then you could start seeing, there are people doing, projects to decrease single-use plastics. So I'm doing a project right now to decrease antibiotic waste in pediatrics, which we waste so many drugs and antibiotics because we don't put stop dates in, and it's weight-based dosing. So we're doing an automatic IV to PO conversion and decreasing ampicillin waste. So I don't feel like I know where I can publish those.
Publish some of those things. We just did one on Singapore and a sustainability project in a place in Singapore. I have a couple that we're looking at on Caribbean projects. And so, yeah, we do that. We are not going to do something that's totally repetitive of something somebody else has done. It's got to be something that's got some new information with it.
That makes sense.
Because we have done things, but yeah, we will publish that. And what we actually call them is case reports.
Yeah, case report style.
I think we should call it sustainable quality improvement.
Well, we don't call it that. We call it
It's like a research paper. It's not a research paper. This is really a description of a project. It's more like a
description of a
case
project.
report. It's
Yeah, it's a case
look at
report.
it.
I mean, if it's a research project, then call it a research project, but it can also be a, emerging issue, but depending on what it is. But that's how I've handled it. I had the paper sent to me from Singapore and said, create a case report out of it. What else?
I got a question back, but Dr. Salman, maybe you
Yeah,
want
one thing I was gonna add is, so we've done sort of opinion pieces around this, but in terms of that research, so we have two daughter journals. There's NEJM Evidence and NEJM Catalyst, and NEJM Catalyst is healthcare delivery. And they also will sometimes do description, but you need to know the outcome. It can't just be like but it sounds like that's what you're talking about.
I mean, I think it's existing quality improvement projects that you just incorporate some sustainability focus.
Yeah. So it's usually right, for example, to the editor of the catalyst.
Okay.
Just ask, they definitely.
Okay.
Some things that help.
Good back order.
Thank you for all three of you for your really helpful presentations, and also mentioning the importance of what you're looking for in terms of representation of different ethnicities and international sources. I lead a group, the Global Network of Scientists and Clinicians, and we do a lot of work. We have scientists coming from 35 different countries, and most of these are lower middle income. It's really important for us to get their voices heard in editorials, perspective pieces in research, have data from research. And one of the things is important for us also is about the accessibility of science and the open access. But to be able to do open access for most of these articles, we have to pay extra fee. That's no.
For ours, there is if you're a lower middle income country, it's free. If you're middle, there's a little charge. I mean, there is a stepwise, and like for our current one, they're free until March 31st, and we've been advertising that for a year, but our LMIC articles are free. And I have to tell you, we have put a lot of effort into some of these papers. I mean, literally, we've got, papers from Ghana and Bangladesh, and, most journals will not have more than 2 go-rounds and revisions. Well, so what's your highest? What's your highest?
Oh, I mean, multiple, I'm sure.
Yeah, we probably can top all them, because there's been papers that we've really wanted to help the authors get into the journal, and they may be some of the most downloaded. So the efforts are worth it, and it is important.
Because one of the ways we're trying to do it now is we partner with, for example, I have affiliation with Columbia University, so we try to partner with these other institutes, but then it doesn't come into the category of LMIC, but we do need the funding to be able to make it open access. So on. So I don't know, is there a way to turn around or discuss it with editors, or do you have any?
Well, editors don't have really any control necessarily of it, but I think the key is, and I don't know who the primary author is, but it probably goes in by the primary author, and the managing author. I don't think you're just because you have somebody from Columbia involved is you're discounted. So. But I think one thing with LMICs is, and I have to be very, I see a lot of these papers, is it's really important that they're also giving us some new information, because a lot of times people are just trying to advocate in their papers. And so that's a tough thing that we have on our end. We want to help people, but it's got to be more than just advocating.
Yes.
Question sort of goes back to the original point around advocacy and where that lives and how it looks. I'm curious about if you could advise on the best places to publish original framework, maybe some untested or even tested that are interdisciplinary, that really deal with climate and health. And wider enterprise-wide level. And so I'll say I lead resilience planning for UCLA Health and work sort of help think through what we're doing. That's not, there is no sort of if I wanted to put forth like a framework for holistic, eco-centric, multidisciplinary, multi-government planning strategy for healthcare, but no one's really actually comfortable with that yet. Where would that live, or could that?
I mean, we've had people talk about similar topics in Harvard and other places, and you go and you can kind of read some of what we've done in the past. There may be something that you can see that was comparable. It wouldn't be, yeah. Well, I mean, I guess it's a matter of, talking and sharing and that sort of thing. It might be something, but that we would be interested in, but you'd have to frame it in a certain way.
Yeah, struggle yet to the peer review side. That sounds like something you present at a conference, present in other sort of great locations until somebody's moved forward with it.
I mean, or with like Catalyst or like maybe the health forum, the JAMA health forum, like are those venues where that kind of work?
I can certainly check whether they ever do this. They've been much more into an experience of we instituted X and we found Y, as opposed to, yeah.
I have a few more questions. I'll keep going. Caren, I'll start with you, but anyone can answer. When is it appropriate to appeal an editor's decision? And on the flip side, what do you do if you feel like you were left off of a paper? Paper showed up and you're like, well, I kind of worked on that paper. Never mind.
I'll give quick answers from other people. Okay, so generally appeals we don't love them. They have a pretty low success rate, but the time that at least for us, and then you guys should weigh in, that an appeal makes sense, okay, is if you look at reviewer comments, and they basically, it is clear that they misunderstood. They're saying things that don't jive. We actually read papers really carefully. So I want to say for us, sometimes we even know the reviewer comments don't kind of make entire sense. Okay, but we've thought about it and we've talked about the paper. So what you want to do is instead of fixing and answering all the things and writing back, you can just write in and say, if reviewer A's comments were instrumental in this decision, here's all my problems with reviewer A's comments. And then somebody will tell you. And sometimes at some journals, it will have been reviewer A. And that's a time where you should get another, chance. So generally, if you think somebody really missed the boat, I would say that's an appeal time. I'll let other people answer so that I'm not taking all the time.
No, I completely agree. And the most common appeals we get is, hey, I can respond to all these reviewer comments. But as Caren said earlier, a very important point is the reviewers don't make the decision, the editor makes the decision. So I would agree that the one time where maybe it is reasonable if it looks like reviewer A completely misunderstood something. That doesn't happen very much. I mean, as an author, I don't think that happens very much. But if it does happen, I think that would be reasonable.
I got one more. We're running a little long, but we started a little late. We got a little break, so I think I'll go with one more. And this is maybe a little more of a doozy, and I'd love to hear people's thoughts. What are the appropriate and inappropriate uses of AI in peer-reviewed research? What impacts from AI have you noticed in the space in climate and health research?
I'll start, and I think a lot of people from LMICs may be using it, and it's increasing research productivity of people. And I think it's going to be an issue for all of us as time goes on. I bet we all get many, many more papers. And I almost want all the journal editors to come out and say, no.
So there is some guidance on it, which is that you're not supposed to use it to be sort of writing your work. Okay, people use it for if their English isn't their first language or they're a lousy writer or whatever, they might want to sort of clean things up. You're also supposed to honestly say where it was used, and it can't be an author, but it has to be acknowledged. So there are policies coming around it. I agree.
We have the policy,
Yeah.
but I still think the policy isn't enough. That's my own feeling.
No,
We ask authors, did you use AI? And if they say yes, we ask specifically. I will say that's both increasing for sure. I will say that the papers that use it are not the highest quality. I feel like, although I know AI is getting better every month, but I almost wonder if when it's being used, the authors are not carefully checking. Yeah, I did.
And then, it's a really important point as well, though, because you guys know AI screws things up, so you are responsible for those errors. It's not like you can get them on.
And AI is not an author.
And I think the other ethical issue is that it's going to put more pressure on young people. Because there's enough pressure to publish as it is. And if you've got people, especially around the world, being more pressured to get in more papers, and they're just going bang, 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 getting their AI papers done, it's going to cause all of us more problems.
Well, if we have time, we should probably do part 2 of your first question.
Sure.
So you bring
Yep. Go for it.
So if some paper has gone to a journal, okay, and you think it's gone bad, I mean, you can tell the journal that. What'll happen is that paper then, can't go forward. So editors don't know who wrote the paper, and they can't come to your institution and investigate. So things get tossed back to the authors, and it needs to be worked out. And so I would just urge everybody here as an author, is best time to sort of figure out authorship issues is like day one, you're planning a project. And then as you go along, make sure that if you thought you were ex-author, that's what you still are. And so that everybody feels okay when it goes in, because journals can't settle it for you. And it means that really important work that often involved human participants and they gave their time and such can't be published if people are fighting over it. And then you guys, institutions will have ways to help you resolve issues if they arise, but kind of have to resolve. Yeah.
When you have larger groups contributed to a project, how do journals respond to author groups? The third author being the climate and health equity writing group or something like that.
We're fine with writing. We still need a list of actual humans that made up the writing group. But when there's a zillion authors, we're absolutely fine with a writing group.
My issue is the credit question. What are these people actually doing? That's what I want to know. I mean, we had a paper like that recently where a whole big author group was added at the end. No, but the question is the whole group getting their name on every paper? In which case, I think that's unethical. So we need to have a credit statement.
We're fine with author groups too, but make sure you get it right the first time it goes in, because if there's a change in author, every single person on the byline or in that author group needs to acknowledge the new author or the removal and say they're okay with it. That's a lot of work for everybody.
And you probably know this, but when you guys are submitting as an author, so the ICMJ, the International Committee of Medical Journal Editors, has these standards for authorship. So you drafted it, or you are attributed to critically revising it. You signed off on the final version. What am I forgetting? Anyway, you're signing your name to things, and ideally you should have done them since you are signing a piece of paper saying you're an author. So it should be something that's figured out, because ostensibly people were actively contributing. Oh, and also taking responsibility for part or whole of the content. So again, just sort of starting early in a project is a great idea.
We'll take one more question if there is one from the crowd. And if not, yes.
I don't know if this is out of scope, so throw it out, but we're kind of whispering, you guys have presented for me kind of from the bastions of truth, right? And so many people in this room, when we publish, which someday I may do, in JAMA or in England Journal, I'm communicating things that I know factually correct to the best of my knowledge with people who are going to accept it as like likely factually correct. But there's a whole other world out there that we need to speak to and we're not. And I don't know, I guess this is out of scope while we're talking about publishing in scientific journals, but also I don't usually get to speak to the New England Journal and JAMA and hear your thoughts. Like, how do we communicate outside of our world of like data-based fact and knowledge to the people who are going to determine so much what's going to happen to us?
I'll add a little piece to that. How can we spread the information and the truth that we do publish in these journals outside to people who don't read medical journals?
Or don't even believe.
Or even believe it.
And that's the tricky thing. If you went back, however many years, it was like you published something and there was sort of general belief that it was real. And I would like to learn at this meeting as well, how to communicate, but all I know is like we were on a list of people that RFK wanted to sue. So, I mean, I don't, I don't know how to communicate. It's a great question.
I think one of the workshops at 3:30, I'll just say, is about this topic, the one with the Burness and Abby at 3:30. So one of the workshops is about like how to translate this research.
I don't have much to add. It's a great question, and I don't think anybody knows the answer. I mean, we need to do our part by publishing, valid work and making sure the right language is used, that I was referring to earlier. But once it gets outside of JAMA, it's hard to have control on. Sorry.
I would look at our communication special issue. There's a pretty good article in there about red states and communicating across political lines. And what I would love to see, I would love to have somebody send me a short communication on something they did in a red state. Go to a parking lot at a Walmart and, start doing something and show me what you taught people about climate and health. I would love to start seeing that kind of information. I think that's really part of what we need. Because we're all preaching to the choir here, right? We're the believers. We need the non-believers here. Maybe we need to buy them a beer and start asking them questions.
Maybe a chloride question. What are y'all thinking you're going to do to make sure that the public recognizes the integrity of what it is you do, right? Because clearly we've all published in these journals that are highly rigorous in how they're reviewed, right? The general public needs to understand that process. And needs to understand that that's different than an article that gets published in a journal where those standards aren't met. So how are you thinking about that in terms of building up the public validity of what it is that we do when we publish peer-reviewed?
Honestly, that's also a great question. And we had this whole discussion around, should we try to make, a video about what we do? It feels really self-serving. So if you have an idea, I would love to know.
What do you think? I'd like to know.
I think the public needs to know what the process is. I mean, I think the more transparent the process is and people understand this is the rigor that it goes through, I think that shines a light on when that doesn't happen in other sources. So I think it's really important to communicate that to the general public, actually.
I think you should add Ed Mavick too.
Yeah, he's an expert in this area. Maybe that's a great place to leave it because I think that's a challenge for all of us. How do we spread facts to those who are being given different information and are resisting to it? We feel the truth. Thank you all for coming. Thank you so much to our experts.